Good evening, Peter Goertz. I'm a psychiatrist. Can worrying about patients drive a doctor nuts? Probably. And we want to balance concern about patients with taking care of ourselves. And that can be difficult at times, at least in some situations. What led me to talk about this today is I saw a patient who was receiving amitriptyline, a medication that can be toxic if the level is too high, so it can be important to get levels of the medicine. And I recommended, it was a consultation, I recommended that the levels be checked at a certain time, and then later on, the thought entered my mind, oh, maybe they should be checked a little earlier so that they don't give the patient too much if the level seems to be low. So that type of thing is, I think, pretty routine as a doctor, that you think back and wonder, oh, did I do this right? So another issue that came up, for example, was last night I was on call, the resident called me and we discussed a patient, and then after the end of the phone call, I realized, oh, I didn't ask the resident about the results specifically of the EKG. And then I wondered, do I need to call the resident back? Or is it not that big a deal with this particular patient? And I realized, or I felt it was not that big a deal with this particular patient, so I let it go, and that was that. In the past, I used to get up not infrequently at night if I had a thought, if I woke up in the middle of the night or so and had a thought, oh, I need to do this for this patient tomorrow, like check a blood level or do something that I felt might be important and even impact the safety of the patient. I would get up at night and write it down. I cannot remember the last time I actually did something like that. So I've become much more relaxed about that. And I find that even if I don't write things down, in general, I do think of things that I wanted to think of the next day. Now, in medicine, of course, and in psychiatry specifically, bad things definitely happen. Patients do commit suicide. I've had patients commit suicide. I'm remembering a patient who overdosed lethally, not intentionally. This was a gentleman who shot heroin. So things really can happen. So it's not a surprise that doctors are concerned, and definitely it's understandable if doctors worry. There can be medical issues. Let's say if someone is on lithium and they take ibuprofen, the ibuprofen can drastically increase levels of lithium to a toxic level, and that can cause serious physical issues. So let's say if you start lithium on a patient and you forgot to tell the patient about that, you may down the road wonder, oh, I didn't tell that patient, I need to call the patient. And in that instance, you probably do need, in my opinion, you do need to call the patient then about that issue. You may forget to ask a patient about allergies. You may forget to ask a patient if they have access to a gun, or you may forget to ask the family about that. So these things can be important. And also, if you're seeing an emergency room patient who might need to be hospitalized, it's always important, in my opinion, to ask about children in the home. Are there pets in the home that need to be taken care of? So certain things we do need to realize the importance of. And part of what the underlying issue for doctors is, we don't want something to happen and it to be our fault. There's some ego involved there, of course. And one thing to try and realize, in my opinion, is that mistakes are inevitable. We're human. They're going to happen. And at times, you do need to act on your concerns about the patient. Let's say if you're wondering if you're second-guessing yourself or not, and it's about a refill request that a patient made, and it's a medicine that in higher doses can cause what we call orthostatic hypotension. So if the patient gets up too quickly, they may get dizzy. So you get a refill request for that medicine at a relatively high dose. And then you look at the patient's chart and you realize, oh, this patient, it looks like this patient hasn't taken that medicine for months. And if you start the medicine at that high dose without the patient having taken it for a while and without building up to that high dose, that could be dangerous. The patient may become hypotensive, may get dizzy, may fall. So in that type of situation, you do want to call the patient and ask them, have you run out of your medicine? Have you been taking it consistently? And you may get surprised because even though in the computer it looks like the patient has not taken their medicine for months, in reality, the patient may say, oh, I still had an extra bottle from a while back and I'm using that. So they may actually still be taking the medicine. So it is important at times to call the patient. And we want to be careful also with our own needs. It is important to take care of ourselves. But if something is really important and if a patient might not get the best treatment or if something dangerous might happen, it's important to realize, oh, I guess I have to stay late. I'll have to call my wife. I'll be late. We're not going to be able to go out to dinner at the time we wanted to. So we do want to prioritize safety of the patient in a situation like that. And you may need to stay late at times. You want to try and avoid that because you don't want to get burnt out. You want to definitely balance taking care of patients with taking care of yourself. And you want to be able to set boundaries. So that could be with a patient. If the patient is demanding, wants you to stay late, for example, and address more issues, even though the session is over, the visit is over, or if a family member is very persistent, is pushing you to do something and you don't feel it's appropriate, or that would take a lot of time and you don't have the time during that visit, then you do often need to set that boundary. So it's important to be able to say no. You may want to make no one of your favorite words, and you're going to be able to hopefully say no to various other people. For example, the patient, if you don't feel the request or what the patient is asking for is reasonable, a family member, for example, a colleague, a resident. And if the person whom you say no to gets angry, that can be a good sign that you're doing the right thing for yourself, of course. So potentially worrying about patients can be a difficult issue and can be troublesome for a lot of doctors. And we want to do our best to realize that we're going to make mistakes. We don't want to be negligent. We want to be very careful. We want to be conscientious, but we do want to accept the fact that we are going to make mistakes. We're not perfect. We're human. And at the same time, we definitely want to do our best to take care of our patients and realize that we do sometimes have to, if we feel we've made a bad decision, we sometimes have to go back and change our decision and, let's say, call the patient and say, I'm sorry, I prescribed this medicine for you, but it may interact with another medicine you're taking, so it's probably not the best thing. So there are various aspects of this, and it's a very common issue that, to my knowledge, many doctors struggle with. But that is part of the responsibility. I mean, part of what we do as doctors is take a lot of responsibility. So we want to embrace that as best we can and try our best or do our best not to worry. We can be concerned, of course. We need to be concerned often about patients, but we want to definitely also take care of ourselves. Thank you.